Welcome all. Question for the day. What is the rationale of using ACE inhibitors in heart failure? We all know angiotensinogen is converted to angiotensin 1 with the help of renin. Angiotensin 1 is converted to angiotensin 2 with the help of angiotensin converting enzyme, that is ACE. Okay, this angiotensin 2 will go and act on angiotensin receptors, mainly AT1 receptors, which are mainly present in the blood vessels, adrenal cortex and in the adrenal medulla. Okay, so when this angiotensin 2 goes and acts on angiotensin receptors which is present in the blood vessel, what happens? There will be vasoconstriction. So as a result, there is increase in preload and increase in afterload happens, which is dangerous for failing heart. And whenever this angiotensin 2 goes and acts on angiotensin receptor which is present in adrenal cortex, what happens? There is increase in aldosterone secretion. And if there is increased aldosterone secretion, what happens in collecting duct? Sodium and water reabsorption is increased. So there is increase in sodium and water reabsorption. So as a result, it leads to edema. So if there is edema, it also increases the preload of the heart, again which is dangerous for the failing heart. And this increased aldosterone secretion also causes loss of K plus and H plus ions in collecting duct. So whenever there is prolonged increase of aldosterone secretion, it also causes cardiac remodeling. Okay. Now, when this angiotensin 2 goes and acts on angiotensin receptors which is present in adrenal medulla, what happens? There is excess release of catecholamines will happen. So as a result, the work of the heart will increase. So again, which is dangerous in case of failing heart. So all these things are happening. Apart from that, ACE is also responsible for metabolizing the bradykinin. So this bradykinin is a powerful vasodilator. Okay. Now, when we give ACE inhibitors, what happens? This ACE inhibitors will go and inhibit this angiotensin converting enzyme and prevents the conversion of angiotensin 1 to angiotensin 2, and thus preventing all these effects. Which means when we give ACE inhibitors, we can prevent this vasoconstriction. So as a result, we can decrease the preload and decrease the afterload of the heart. So when we give ACE inhibitors, there is no increase in aldosterone secretion. So no increase in sodium and water retention happens. So there is no edema. So finally we can decrease the preload of the heart. So when we are decreasing the preload and decreasing the afterload in failing heart, we can improve the cardiac output, which is beneficial in failing heart. And when we give ACE inhibitors, we can also prevent this cardiac remodeling. So in this way, it decreases the mortality also. Now, when we give ACE inhibitors, we can also decreases the work of the heart by decreasing the excess release of catecholamines or by preventing the excess release of catecholamines. So in this way, ACE inhibitors will act. Apart from this ACE inhibitors also prevents the metabolism of bradykinin. As a result, levels of bradykinins will increase. So vasodilatation will happen. So afterload is decreased, again which is beneficial for failing heart. So all these things are happening when we are giving ACE inhibitors. So these are some of the important rationale why we are using angiotensin converting enzyme inhibitors in heart failure. Thank you.